So again, good morning, everyone. My name is Chris Hanley, and I'm coming from the National Academy of Medicine, where I serve as the director for our Grand Challenge on Climate Change and Human Health. And before I get started, can I just say how wonderful it has been over the last 2 days to be here with you all, not just on this stage or in this room, but really like in this community. It has very much filled my soul. And so I hope you're all feeling the same. And from talking to many of you, I get the sense that that is kind of what we are collectively feeling. And in the spirit of that, I'm very excited to be joined here by some of my friends on the stage, where we're going to be talking to you all about catalyzing collective action to decarbonize the healthcare sector. And we're going to jump right into our session, which we built a little bit different. It's a little bit more of a fireside style. So I'm going to launch immediately into my questions for my fellow presenters. And then hopefully we get a lot of questions in and we spend the bulk of our time, or a good portion of our time, in the Q&A session. So with that, I'm going to jump right in and ask one of my favorite questions to anyone who I find out is has devoted either their entire life or even this part of their career to climate and health. And that's what brings you here. So Emmie, we'd love to hear from you first.
Thank you, Chris. And good morning, everyone. It's wonderful to be with you. So there's really two reasons to most directly answer the question. I'll just jump right in with, there's two reasons why I'm here. The first reason is that I am deathly afraid of needles. And this is relevant, I promise. It's relevant because I wanted to be a doctor growing up all my life. I studied, up to a certain point. And then I was observing a procedure and I fainted, and I realized this is too much bodily fluid for me. I need to figure out a different path. So I went into public health. That's the first reason why I'm here, is that I said, I really, really admire all of those who have gone into the medical profession and are clinicians working in that capacity, but it's not for me. And I think there's great power actually in moving upstream and really protecting the public's health in that way. So I'm a public health professional by trade, and that's one of the reasons why I'm here working on climate smart healthcare. The second reason is more deeply personal, and this is where the slide comes into play. So in this upper left-hand corner here are a couple of photos. The first is a photo of my wife. She's a submarine officer in the U.S. Navy, and we have directly experienced on at least two occasions mold and flooding in the places that we've lived at shoreline military bases across the country. So have had some very, very real direct experiences with dealing with different climate-related disasters and events, including on the first home that we purchased about a month after had severe damage. And then the second deeply personal piece is a photo of me and my grandmother here in the top left. I'm from Colorado originally, and the exacerbating wildfire seasons have had an impact on my grandmother's asthma, including a particularly bad episode when she actually had to be intubated and went to the emergency room for the difficulty breathing that she had during the Waldo Canyon fire back in 2012. So that's why I'm here. Those two reasons: the fear of needles, and then the deeply personal way that this impacts me. And I'm sure we've heard lots of stories of self, so perhaps many of you can relate to that as well. That sort of experience and the connecting of the dots between climate and health really led me to start writing more about this intersection. So this article that's kind of in the top left corner was an article that I wrote with a leading child and maternal health doctor in the space, where we started to connect the dots between the maternal health crisis in the U.S. and the kind of climate disasters and the increase of those impacting the most vulnerable in our society. I really come at this work with an understanding and appreciation that you can't have healthy people on a sick planet. That at its core is the reason why I'm here and why I do this work. So that's this little first quadrant on the upper left. I'm going to go kind of in a circle. This is a little bit of the structure of how we've designed this session for each of us. So that's the first quadrant, is why I'm here, is that I really believe and have seen and directly experienced that you can't have healthy people on a sick planet. The second reason that I'm here, or what has brought me to this space, is I really worked mostly in the resilience space. So thinking about how are we preparing for the impacts of climate on our health, how are we protecting human health in the face of climate disasters. But then I also began to dig in further and understand that the healthcare system, the healthcare sector itself was contributing to the very harm that its patients were experiencing, right? Patients coming through the door who were experiencing extreme heat or other kind of health conditions related to climate-related events or air pollution. The healthcare sector themselves were contributing to that pollution. And in particular, we know that the healthcare sector is responsible for somewhere between 8.5% to 10% of emissions here in the US. And this is part of the work that I help lead as our Chief Program Officer at Healthcare Without Harm and practice Greenhealth. So that is the specific frame that we bring is thinking really about how can we partner with the healthcare sector to not only ensure that they are on the front lines of treating those who are most vulnerable in our society, who are impacted by climate change, by air pollution, by the many other impacts of environmental degradation that we have, but also how can they clean up their own house, right? And so we've been working with a number of our health partners around a particular goal that we've set. One of our goals is around encouraging our partners to reduce their emissions by 25% by 2026. And this is intended to be in line with the Paris Agreement goals, the goal that we know is what we have to achieve in order to prevent the worst possible impacts to our world of reducing emissions 50% by 2030 and then net zero by 2050. So that 2026 is kind of an interim goal, that 25% on our way to the 50% goal. And I'm really excited to share that luckily we have been able to have some pretty important gains in the short term. So this graph here on the right-hand side shows that in 2024, our partners actually reduced their emissions in Scope 1 and Scope 2 greenhouse gases 8.7%. So we've gotten 8.7% of the way there. We've still got some more progress to achieve, but it's significant and meaningful that our healthcare partners have reduced more than 250,000 metric tons of emissions just in 2024. So something to celebrate as we are looking to work with the healthcare sector to decarbonize. Now, I mean, this is certainly a good accomplishment, but there's a lot of work ahead. And this leads me to my final quadrant here, which is, a lot of good work that is happening, and we'll get a little more into that in the Q&A, but I'll just spotlight two big themes for our work ahead and the way that all of you can continue to be involved or to get involved if you're not already. The first is that we are working hard to make change within healthcare institutions. So all of you, the consortium, the Association of American Medical Colleges, the Alliance of Nurses for Healthy Environments, there are so many organizations here who are a critical part of this journey to work hard with healthcare institutions on decarbonizing their operations. And my colleague, who's also in the audience today, Dr. Emmie Collins, is our medical director, and she's really working closely with medical and clinical directors of sustainability, as well as other health professionals, to really support and kind of pitch within their institution the importance of decarbonization and the importance of health system leadership in terms of decarbonization interventions to move forward. There's a photo here in the bottom left of our physician network and a number of the health professionals, I'm sure to include some of you who are in the audience today who are really driving this work forward at your hospital or at other institutions to ensure that leadership commitments and pledges are held accountable to making that change of emissions reduction in health systems. The second sort of big theme about our work ahead is to really make change in targeted and diverse ways. So if you're working, many of you are working on healthcare decarbonization already, you might be leading the shift at your facility away from a single-use product towards reusable or reprocessable. You also might be implementing a really robust waste reduction program at your hospital, or you might be garnering support for reducing unnecessary testing and procedures to ensure higher value care. Whatever the case may be, whatever the intervention is that you are doing, there's no one right way to do this. All of those are valuable contributions, and they're all important steps in that journey for healthcare decarbonization. One way, though, if you're just getting started or you've kind of had some initial achievements and you're thinking, where do I go next for healthcare decarbonization? I encourage you to think of a kind of matrix that I always go back to, you might be familiar with, and that's the effort impact matrix. This is in the kind of bottom left-hand corner here. The idea here being, if you can identify those interventions that are the lowest effort and the highest impact, that's the best place to dedicate your energy. Those are kind of the quick win categories, or the things, low-hanging fruit is sometimes what we call it, right? Those are the places to devote the initial focus and kind of concentrate there. Now, that's going to vary facility to facility, but all of those organizations I named, as well as Healthcare Without Harm, we're here to sort of support all of you as health professionals in that journey of figuring out which interventions to start with. You also might add, and I don't have it on this graphic, but you might add an overlay to this impact effort matrix to say, not just what are the low effort, high impact areas of focus, those quick wins or those big projects, but what are the places where health professionals are most essential to the work? What are places where, we need health professional input, expertise, leadership, perspectives to really drive change at the institution? So applying that lens as well can be helpful. So we'll get more into details in the Q&A, but that wraps up a little bit about why I'm here, what brings me here to this work, and a little bit about the work that my organization does around healthcare decarbonization. I'll pass it over to my colleague, Beth.
Hello, I'm Beth Schenk, Chief Environmental Stewardship Officer for Providence, a large health center in the West. And I was reminiscing yesterday when a few people brought up their 12-year-old story. My 12-year-old story was a group I conjured up called the APs, anti-pollutionists. And we had a event in our neighborhood where our lovely parents, God bless them, came and bobbed for apples. Can you believe that? A whole bunch of them. And we sold Rice Krispie treats. And we made $28. And we gave the $28 to the city who bought some trees, or probably a tree. And I remember thinking, well, that's kind of interesting, that you can actually get something done. And then secondly, it was like, what? $28? So I think that helped me to learn to think bigger. So that's what's been going on ever since. Up in the top left, there's the person that you can barely see, who's second from the right, is me in 1993. The reason I show you this is because I'm an example of the long game. So this is a long game if you choose to accept it. A lot of people come and go, and I would say to you, don't go. It takes stamina, it takes steadfastness and persistence, but really we can get a lot done, but it doesn't happen overnight. So I'm a testament to that. Next on my group here is Providence. You can see that's where our hospitals are. I lead this work across all of them. It's 54 hospitals and 1,000 clinics in 7 Western states. It's helpful that it's in 7 Western states right now, at least for California, Oregon, Washington. Helpful trends, different than the rest of the nation. I want to point out very quickly the We Act, We Reach, and We Share. That is our climate action plan. Some of you have heard this before. We Act is our mitigation, and that stands for things that can be helpful for you. It's certainly helpful internally. Waste, energy and water, agriculture, food, chemicals, and transportation. Those are the key inputs. Those are the key sources of greenhouse gases. So when we're talking about dialing down greenhouse gases, this is what we focus on. We have multiple projects running across multiple platforms and sites in each of those categories. It's great to see the progress. And we know about that because we have the We Act scorecard. That allows us to actually measure and report our progress. It collects automatically now after years of hard work. It collects the usage of a particular thing, how many gallons of water, kilowatt hours, doses of desflurane, et cetera, the cost of it, and the carbon emissions of that. And it does it every month for every hospital and now clinic, going back to January 2019. Unbelievable what that does for your ability to see progress and report progress. We Reach, briefly, is our resilience strategy. So in these fires just now in California, we had a clinic burned to the ground. We had 2 major hospitals almost within a half hour evacuate. That is horrifying to people who try and deliver care. It's amazing what happened. Many people lost their homes. That's what we're up against. That's what we're living with now. The heat dome in Portland a few years ago, 116. We did have to close some units. We did have door frames and door jambs and window frames warping. It was so hot. And then the buildings were hard to manage. Nobody expected 116 degrees by then, but we just heard today. It can be the deaths, the 1,000 deaths or so that happened between the Canadian border and the California border could have been prevented. We were shocked by the 116, but it's going to happen again. 120, most likely. We're not ready. That's our resilience work. That's a big bucket of work. And then we share is our advocacy relationships, like all of this, and like what we do with NOM, Healthcare Without Harm, Annie, many others. Those are intentional, strategic relationships that help us elevate our voice, because that's part of our job as Providence, and help us move this sector, be part of the movement of the sector forward. Okay, back to the little boxes here. I say bold goals are crucial. You need long-term goals and short-term goals, but mostly short-term goals. Long-term goals are too far out there. It's too easy to procrastinate. Short-term goals are more actionable, measurable, and reportable, and we need to make progress today. I would also say measure and deliver feasible solutions. You can't just be promising the sky, and that's the work of the sustainability leadership. That's my work. Well, what are the feasible solutions? And we are finding them, and we are sharing them. We share them with all of you. You can actually go and look. You look on our website, there's a place, I can show you later, but anyway, there's a place to download toolkits, because we try and put out one a quarter, and they're helpful, practical guides that other health systems can use. For instance, our nitrous oxide disconnection toolkit, or our recent strategy and planning toolkit. Okay, I gotta go. The other one I like to say a lot, because we really rely on this, is data are the backbone. You can't do this in a data-driven, evidence-based world of healthcare. You can't do it without the facts. Data are the backbone, and engagement is the secret sauce. Because if we could unleash people like up there in 1993, that is the power to make this happen. So really working with and finding ways to manage that energy, and also direct it in ways that are going to be helpful and impactful. We don't want to just spin our wheels. And then lastly, for us, Catholic, faith-based, nonprofit, 170-year-old organization, big events don't happen, big things don't happen intentionally unless they're aligned with the mission. We anchor this directly to that, to the promises that we've made to the citizens in the communities we serve, to our core value, and we anchor this specifically to our core value of justice, because that's where it fits the best, according to me and many other people. So I'll talk more about that in our questions, but I gotta go. Thank you.
There I am, just on one screen. Okay, that's fine. Good morning. Glad to be with you. My climate awakening, I'll start. I had an awakening before I had a journey. And my awakening also goes back to the early 1990s when I was in training, and there was some stuff going on at the federal level about healthcare reform. And I realized in the midst of training that there was all these bad things happening, and there were all these underserved patients. And I realized that suddenly healthcare reform on the federal stage with the Clinton health plan was like being talked about. And that never had happened, at least in my being before. So with that as a kind of starting point, I became awakened to advocacy and the importance of the physician voice in advocacy. And I started that through the American College of Physicians. Since I was an internist, I'm a practicing rheumatologist in New Haven, I should say. And I got involved with the local chapter of the ACP at that point, and the ACP nationally was getting involved in health reform issues. Through that, also the State Medical Society, the Connecticut State Medical Society. And through my advocacy, I became very involved at the state level with just all sorts of advocacy. Climate was not at all on my radar at that point. But I became very engaged with how to do advocacy, how to talk to legislators, how to figure out how to spend your time well, and figure out who the influences are and where to not waste time, but spend time well. So with that advocacy, I kind of was very involved with the ACP through 20, 25 years, had the very good fortune to become president of the ACP 5 years ago. And as that was happening, and I was president, I had even more advocacy opportunities. You can imagine, you are given kind of a real platform to talk on behalf of an organization and to interact with a lot of people, a lot of organizations. So you see there a picture on the Capitol. I was meeting with 6 leaders of other large organizations. We came and had a fly-in twice a year to DC to talk about various issues. Climate was not one of them, as I recall, back in 2019. Had a chance to speak at press conferences, all that kind of stuff. And I realized the importance and the significance of getting professional society's voices heard, not just physicians, but others. With that, I'm kind of going to go around clockwise. I realized that communicating locally was also, I had an opportunity as a person who kind of was prominent to do talks. And so I started doing more and more talks on climate as I became involved with the climate movement through ACP leadership and then the Medical Society Consortium. So I'm going to kind of come back around to that last box. So what was a real synergizing event for me was when I became ACP president. The first event that I came to was this meeting in the spring of 2019, and met a number of people here, was like awakened to, wow, we have advocacy in lots of angles, but especially in climate and health. I should say, I skipped over, the ACP put out a big policy paper back in 2016 on that upper right around climate and health. And it was really, I think, the biggest paper that a physician organization had done, and I'll have to defer to Mona on this. It was a energizing force that helped brought together some of the entities in the consortium. 9 entities, organizations came together, 2016, 17. That's how this kind of all got started. And so on that first meeting that I came to, I had the good fortune of going around to the Hill, and I think no one else from Connecticut was here. So Mona went with me. And that was like what really made me go, wow, how do you talk climate? How do you get turned on to this? How do you really just kind of think about this as a physician advocate? So that's why there's a picture of me with Mona, with my rep, Rosa DeLauro, back in 2019. So then the consortium became kind of a passion. We had a steering committee. I became one of the members of the steering committee and the chair of it for a couple of years. As the consortium, which many in this room know, moved from an educating type body to one that became more of an advocacy body, which has been an exciting thing to see and which you can really feel here today. And then through the consortium and kind of connections, I had the good fortune to be asked to be part of one of the working groups with the collaborative, the Action Collaborative, where I met Beth and a number of other people. And that's like real collaboration, because it's not just physician organizations, it's insurance companies and health systems. And it's really a whole lot of people trying to get together and figure out how do we move this forward. And, I should say, so as part of that, one of the physician organizations is the AMA. I was not all that involved in the AMA until I was in ACP leadership. But I would say that the AMA, and if you're not aware, has come a far way to become a major voice in this. The AMA has policies about, calling public climate change a public health crisis. A lot of that has been major and has been changing in the last 5 years and continues to happen. So it's exciting to see how the physician voice in this large set of voices can be influential. I'll stop there and have questions.
So the question was, what brings me here today? And I think the question is, how can we not be here today, right? We heard that about, and I would say the numbers show anywhere from 7 to 10% of greenhouse gas emissions are coming from the healthcare sector. And about 30% of those emissions are coming from the operating rooms. And so as a surgeon, the question is, what can I do to catalyze decarbonization? And, we heard this a little bit yesterday, but we are the consumer. So we can help direct a lot of the choices that are being made in terms of what things are being bought and how we are utilizing certain resources. I don't have my slides, obviously, but and so I think there's a couple of different ways that I've sort of approached this. And my big thing is, you don't have to be in a position of leadership. You don't necessarily have to be in the room where the big fancy decisions are being made to make a difference. And so one first example is peel packing of instruments in the ENT clinic. I really like to think local. What can I do within my own clinic, within the resources that I have available to me, with the power that I have available to me? And so Jacob put out Jacob put out a statement for our for ENTs that basically said instruments that were used in a clean contaminated capacity don't need to be peel packed. And that's like when each instrument is individually peel packed. But during COVID, a lot of clinics went into sort of overdrive, and they started, doing all this extra packaging. And so every single clinic instrument was peel packed. And so we're in this clinic, and all of a sudden we have to open up all of these different instruments for just cleaning out an ear or for looking in the nose. And so I reached out to our infectious control team at NYU, and I was like, this isn't necessary. We have JCO's approval. Like, can we work on not peel packing these instruments? We'll still clean them. And so, initially it was like a couple of emails, right? You don't get a response, you keep emailing again. It was like Dr. Schenk said, this is a long game, right? Insistence pays off, persistence pays off. And so finally, after a bunch of emails, they came in, met with me, we talked about it, and then lost a follow-up, right? We all know what that's like. And so, but I kept emailing and I kept following up. And then 2 weeks ago, they came by again and they gave us approval to not fuel pack the instruments. And so persistence is key, right? Try to be, it's like being like, annoying in a nice way, but really like knowing what you want to do. So the second part of my decarbonization roadmap is working with our professional societies. So as a surgeon and as an ENT, I can promise you your society is not going to be as conservative as mine are. But yet, both of these, our ENT Academy and the American College of Surgeons, are working on efforts to put out at least some sort of statement related to sustainability and climate change. And so it's really, again, when we have the approval of our larger organizations, that's how we are able to mobilize all of the other healthcare professionals that also are in our own industry. And so again, as much as you may think that this is also like not an area where you may get some progress, the answer is you actually can. And even for the American College of Surgeons, I remember emailing them back in like 2016. And it wasn't until 2020 that I got an email back. And basically it was like, because every 6 months I kept emailing them. And then in 2020, the email was like, so I've heard your name, like you've been like reaching out about this, like let's talk about this. And it's been a slow road, but again, it's just really making sure that people know that this is something you care about. And as we mentioned yesterday, talking about this makes it the social norm so that everyone else is like, oh, this is actually something relevant to me as a physician, to me as a nurse, to me as a pharmacist. And so then we're all thinking about it as a community. The third area is engaging with policymakers. So obviously this is like a huge goal of the consortium, and everyone's going to the Hill tomorrow. And it is really talking about climate change is a health issue, but then also thinking about the broader scope of things and what can we do from a decarbonization standpoint? How can we think about working with industry? Again, it's sort of like trying to address this from every tier that we can. And of course, policy really influences the decisions that are made from a healthcare industry standpoint. And then the last area, and this is some advice that I got from Dr. Lezeritz a couple of years ago, is to be experimental. There's no one right way to decarbonize. And I say this because, I've tried a couple of different things. And I think what really matters is that, again, we see what's in our scope of actions, and we try whatever it is that we're able to do to influence the people that are around us. And so this includes both, I think, we need to publish more in our academic journals. And so in JAMA Surgery last fall, me and a couple of other surgeons wrote about how surgeons need to lead on decarbonization. And then of course, we also need to still be publishing as much as possible and talking to the media as much as possible about how much decarbonization is important, right? Decarbonization, we talk about it in transportation and agriculture, but we also need to be talking about it to address these 8 to 10% of emissions in the healthcare sector so that people are more aware of it. And so again, we create a social norm of how decarbonizing healthcare is really beneficial to public health. So thank you. And thanks for that.
We have a couple of questions to run through, and maybe we'll ask for about 60-second responses from each of you if we can. So it'll be quick. So we'll get to the decarbonization question in a bit, but I want to take a step back and look at a bit of a higher level and ask each of you and hear from you all a simple question, which is how do you catalyze collective action? And maybe Beth, we can start with you.
60 seconds, 3 points. One, what we're doing here, working intentionally with groups across the nation, across the globe, in your region, et cetera, in our professional spaces. Really important, and important that we're smart about that. Second, engagement in a practice area, or in my case, 54 hospitals and 1,000 clinics. Super important. I mentioned it's the secret sauce, and I made some notes. We have 41 green teams. We have a group that's been meeting every second Wednesday since 2008 called ACES, the Action Collaborative for Environmental Stewardship. People can come and go. Everybody's invited, always engaging. We try and work with every single division, from HR to finance to buildings to clinical to infection prevention, et cetera, all across the health system, because this has to be embedded in our work going forward. It needs to be a default rather than a surprise. We have multiple communication strategies that we carry across, from SharePoint and pre-made templates to newsletter, social media, publications, monthly blogs. recipes. Yes, recipes, usually made of food you might discard. And that's all super important. And then lastly, what we've been talking about here, because the real collective catalyzing needs to be our voice more prominently and publicly in the public space. So it's really great to hear the talk about misinformation and disinformation, about the comm strategies, about Ed Maybach's work and Senator Frist this morning. Exactly. That's exactly what we all need and want to do. So that, I think, is what we're not doing quite yet. Thank you.
Robert?
Sure, thanks. I guess I would say we need to define for each of ourselves what is collective action, because the word collective is going to vary. It's going to vary depending upon the size of the organization, the setting you are, where you are in your life, career, professionally, whatever. Because I think that we need to leverage what we can do personally, realistically, and where we can best spend our time. So as I kind of said before, whether at an organizational level, at a local hospital level, at your local community level, it's getting involved and getting to the places where you can talk to people, educate people, make them kind of get onto the same page. Because I think that the catalyst will occur at all of those levels. But we need to kind of really, I think, very specifically think, what am I doing collectively, or what can I do to bring in the collection, and then personalize it. Every one of us, as Dr. Frist said, have personal stories. People engage with personal stories. And so whenever we're engaging with people, trying to bring that unique personal angle to it without being too kind of preachy, which is the danger that we have potentially of coming across to people who don't buy all this. So.
Great, thank you. So yesterday we heard that the word of the moment is chaos. And I would say that in order to really catalyze decarbonization is we need to make that word community. And I think that's what we all are doing here, is we're really, looking at each other for inspiration, for advice, for resources to create a community that's going to be working on climate change and working on decarbonization. And so I think there's one big component of that is a lot of data has showed that people really tend to listen to other people who they think are like them, right? Like we see this from a couple of different components of like self-identity. And so from a collective standpoint, right? So it's like the communities that I tend to reach out to are other surgeons or other ENTs, other people in healthcare, right? So the community can be on multiple levels, but really talking to the people as much as possible and getting ideas from them, the things that they're doing, the things that work, and then trying to implement those same practices within your own community and healthcare system.
And I'll wrap us up with two things that build off of my colleagues. The first is start somewhere and start specific. Just do something, right? To the point that we've said of there's no wrong way, there's no exact pathway. Start somewhere and do something specific. And then the second thing is building off this idea of community and Senator Dr. Frist's remarks this morning, which is this kind of collective component, right? Get more involved with the consortium, with the state groups. There's also the National Academy of Medicine Climate and Health Movement. Join that. Get involved in their grand challenge on climate change and human health. Join us at Healthcare Without Harm. There's a number of organizations and movements, and we really will be stronger together, moving at an individual level with those specific actions, but connecting the dots as part of a collective movement.
Thanks, Emmie, and thanks, everyone. And so in the spirit of moving to be more specific, given the challenges that we're facing in decarbonization, the big question now is, now what? Robert, you want to start us off?
Sure.
Yeah.
So I think we all recognize that there are limits to what is going to potentially be happening on the federal stage for the near future. So I would say now what is kind of reminding me that we need to go back and look at two levels, one of which is the organizational focus that I kind of said before. What can you in your own home, town, hospital network actually do that is not necessarily being impacted in some negative way by different regulatory changes, but can just do the smart things that everyone knows is right, relatively speaking. And then looking at, from an advocacy standpoint, looking at the state level. I think one of the things that I learned starting in state level advocacy was the incredible impact, especially that individuals have more at the state level than at the federal level, unless they really know their senator or representative well. It's just hard to get that much impact there. But at the state level, you've got state senators and state representatives. They don't get nearly as many calls as they do on the Hill. And if you become a recognized voice or person there, they're going to talk to you and listen to you. You can show up at their little town halls. You are going to become easily recognizable to those people, and hopefully an intelligent voice. And you can really make a difference there. That was one of the things that really energized me about advocacy early in my career, was having the impact on some local legislators who happened to be a chair of a committee, or they could do something. And when you actually have an influence or have an effect on someone who's at a point of a power of influence, who can actually make it happen, and then suddenly the bill passes, oh my God, it's like, I really made a difference. That's the goal. It's hard to achieve, and it's the long game, because it takes there's a lot of false starts to get to that point. But you have to keep trying, because if you can, that's where the strategy is. Who are the people I need to talk to in the State House? Who's interested in climate? Who's the chair of the committee? So if they don't buy it, ain't going to go anywhere. And those are the people you need to make selective strategic contacts with. So I think the state level, there's a lot that can be done. A lot of states having different laws related to pollution and lots of different things that I think we could do now if you kind of go home.
Great. I think there's two things that we can all do once we go back. The first is think about what sort of education initiative you can do at your own institution. So when I was at GW, they did minimize the use of desflurane. And that initiative, the reason that the anesthesiologist really moved forward on it was because one of the anesthesiologists gave a grand rounds on it. And so just starting by educating your colleagues with a specific initiative, whether it's a specific initiative or just sustainability, climate change, decarbonization, any of these things as a whole, it really tends to, just the education itself tends to make people be motivated to say, oh, like this is actually a relatively simple change that I can make. It's cost savings. There's actually, it's a huge benefit from a decarbonization standpoint. And so it's really trying to figure out, okay, what is it that maybe just by educating the people that I work with may help mobilize an action? And the second thing I would say is talk to people about what they're interested in. And so every time I've given a grand rounds to surgeons or at a faculty meeting and I've asked people, I've actually gotten a ton of interest in different sustainability recommendations. People are like, Neelu, do this, Neelu, do this, Neelu. And I'm like, okay, they appreciate all the recommendations. But it's really helpful to hear insight from other people. And so one of the things that I heard a lot from my chair and other people is we are getting so annoyed that we throw away all these instruments in the operating room. And so the next initiative I'm working on is trying to really optimize our reprocessing program, right? So it's like when you hear recommendations from people that you're working with, then they're going to be more excited about it and supportive of the work you're doing, and you're probably going to be able to move forward more.
And I'll build off of that. I tend to think in concentric circles, right? So Neelu just spoke to individual organization. I want to touch on the state and national/international to the what now question. So at the state level, there is work happening state and locally on decarbonization. I'll give one example is that in Massachusetts, they're the first state ever to do this. If you are a hospital who receives Medicaid funding, and starting in July, you're going to be required to have someone named to lead sustainability and to measure your scope 1 and 2 emissions. So regardless of what's happening federally, in Massachusetts, that's going to be happening. And there are similar states exploring similar actions. And again, also at the local level. And then at the national level / international, there's a number of initiatives that are sort of garnering support around stepping in where there's an absence of federal leadership at the moment. So thinking, for instance, about the Race to Zero and Race to Resilience programs that the United Nations are leading. This is the kind of largest movements of non-state actors, not just healthcare, but across the entire economy and a number of different institutions saying we're moving towards decarbonization and towards meeting these goals as non-state actors in collaboration with governments and countries around the world. And similarly, more specific to the US, America is All In is an initiative saying in the absence of federal leadership, or if the US pulls out of the Paris Agreement, we are still in, all of the organizations, hospitals, health systems, cultural institutions, higher education institutions, we are still working towards those goals that have been outlined in the Paris Agreement. So keep working towards those. There are initiatives at the local, state, and national level that are still happening. There is still momentum, and those are worth getting involved in.
I would say, whatever you're doing now, keep it up. That's the first thing. It's not a time to turn away. I know that you know, this is a really incredible time, and it can easily feel like we're just getting bowled over by all that's happening. But so I guess I would say the first thing to do is steel yourself, you know, say, oh, this is happening. We're not crazy. Somebody is, you know? But we need to really persist through this because there's so much that has to be done. The physics haven't changed. The physics are plowing ahead. We got, you know, these things are really happening. And I come back to, because this is how I am. What helps me when I'm upset or confused is to act. Do something that I know is going to work and be effective and have some impact. It takes a while to understand what that really is, but there are ways to know that. So I would encourage everybody to keep doing that and keep reaching out to find more. One thing that I do think we need to know better about the science of some of this work that I do, is really building resiliency into our buildings and into our caregivers, as well as the communities. I mean, how are we going to really be there? You know, it's overwhelming to think of these fires ripping through downtown LA. Is just overwhelming. But yet, that's what we're here for as health systems and as health professionals, is to continue to be there to serve. So we need to understand ways to do that better. That's one way that in Providence, our focus is moving more in that direction, because partly we're really handling a lot of the mitigation, not everything, trust me, but we have a major plan. So I'd say what we do now is steel ourselves and keep going. Thank you.
All right, one last round of questions with panelists before we turn it over to the audience. And I want to drill down just a bit further. And I've heard very much over the last 2 days, like people are hungry for action and hungry for what to do. So the last question to each of you, and Neelu, I'll turn to you first. You did cover this a little bit in the grand rounds the grand rounds that you just shared. But what is 1 or 2 or 3 actions that anyone in this room can take, no matter where they are, no matter what kind of support they have from their home institution? What can they do after leaving this room to help support decarbonization?
One of the biggest challenges with decarbonization is knowing where to start. And so I think a lot of this starts with like educating ourselves on what are the actual measures that are really going to be impactful for decarbonization. And so I was talking about this with some people yesterday about how some of the things that you'll initially hear from colleagues is let's recycle, recycle, recycle. Recycling is great. But we also know the limitations of recycling. And so I think it's really important to think about like, okay, what are actually the action steps that are going to have a much more higher impact if I'm going to be starting this as I move forward. And so educating ourselves, going back to our institution, getting ideas from other people. So there's an ENT here, Dr. Lalikia, who has a gloves off initiative in her own clinic. Basically, like, why are we using gloves all the time? There's only certain situations that we actually need to be using gloves. And so like getting ideas from other individuals who are at this conference of things that they're doing, again, in their local space that you can implement yourself. But yes, I think education of ourselves and then of the people that we work with is really instrumental. Knowing that there are so many people who care about this, we're not in this alone, right? We have a huge community of individuals and organizations that are supporting this work is really instrumental in giving us the strength to move forward. Knowing that a lot of these sustainability initiatives are cost savings initiatives also is really helpful when we're talking to the people in leadership who are ultimately the ones that have to give us approval for making these initiatives. And persistence is key. The more people hear things, the more they're likely to say, okay, at some point, and let us move forward with these initiatives that are going to help with decarbonization.
I'll just build on that briefly to say, you know, I think one piece of advice would be find or be that champion in your institution. We heard from Neelu about the persistence of kind of continuing to follow up. And at Health Growth Without Harm, we work with thousands of hospitals across the country. And it astounds me how many of them, this work is being driven by really one, maybe a couple of super passionate people who are able to successfully bring others on board with them. So either be that person or find that person and join them to really champion this work, because it is astounding how much you really can drive as that individual in the institution. Maybe I'll just tack on a second piece, which is related, which is to say, we heard a lot about, you know, really making this work concrete, identifying the impact to human health, focusing on kind of those personal stories. Beth spoke a little bit to this, but also focus on your institution's goals, right? What are the existing priorities that you have, or what is if it's the mission or the focus on justice that Beth spoke about for Providence, or, you know, is there a a set of 3 goals from leadership for this year. What are those, and how can you hitch your wagon around decarbonization to whatever those might be? And you can get really creative around this, whether it's cost saving mechanisms or, workforce sort of shortages. How can we address those existing priorities by kind of netting or dovetailing the decarbonization work into there? And if you need help in kind of making those dot connections, that's part of what we're here for. What the National Academy of Medicine is here for, and many of these institutions, is to help make those connections, but focus on kind of that specific institution level existing priorities and goals, rather than kind of recreating a new agenda.
Sorry about that. I was listening so intently. I want to go back to the concept of courage, because I was struck, it's come up a few times, and I was thinking to myself as we were contemplating that together, that I don't know that I really depend on courage. I don't have to muster up courage very often, and I wondered why that was. And I think it's because what I have cultivated over the years is conviction. Now, I haven't studied these terms, so I'm not really sure, but I think it occurs to me that that's an important first step in terms of aligning what we care about with how we live, with where we put our energy. And I think of that like, as, can't do this with the microphone, kind of coming together in alignment. And that, I think that's conviction, maybe. I'm not sure. There's probably other words. But that feels like, a big wind in my sails, a buoy, taking me forward. And I don't know if that's helpful for folks who are especially feeling, the pain of today. But I would recommend that. And then I would say next, do what you love. You can do anything in this world and do it toward a just future, toward a planetary sanity, perhaps. And so, I can look at all the people I know here and say, you are doing that. You are each doing this marvelous work in the areas that you care about. I think that's really, that then fuels you further. And it also addresses the problems at hand. Thank you.
So I love that concept of conviction. I was kind of thinking toward leaning toward what's your own personal mission in doing this. I think everyone in this room probably has a mission to do better, to do right, to make the world a safer, better place, all that kind of stuff. And if it is part of your being and you just do it and it's second nature, I agree. I don't think of it as courage. It's just what you do. Courage is in the face of, tremendous adversity, and there is. And so maybe it takes a little bit more effort, but I don't think I ever used the word courage either. In terms of kind of what to do leaving the room here, I'd kind of mentioned before already, I think there's a tremendous ability to impact at the state legislative level. So I would urge everyone, go home, look up what are the climate bills that are in your state legislature now, who's pushing them, who's not, and start making contacts, because it's probably pretty easy to have an impact on some of those people. See if there's a public hearing, and you go to the public hearing and you testify. The impact of that stuff at the state level is absolutely tremendous. And if you've ever done it, you kind of see that. But also because if you go as a voice of reason and wisdom, you will stand apart from the people who are sometimes just crazy and silly that are speaking at these public hearings, I must admit. You don't want to be that person, but if you frame it correctly, hopefully you won't be. But it's incredibly important to get that work out there. Now, the other thing to do, I think now, go home to your institution. A lot of places have like sustainability committees, hospitals, health systems. A lot of them are doing great work. A lot of them are check the box. It's like, oh, we set up a sustainability committee and, who's on it? I don't know any of those people. Is there a physician voice? Is there a nursing voice? Probably, or maybe not. If you can get yourself inserted there, you can make an impact because you will bring a perspective that those types of committees and groups need. And until you go looking, you don't even know that it exists because it's kind of hidden on, page 20 of the website. Because it's, as I say, it's a check the box. It's not really doing stuff. The places that are doing it are incredible. There are a lot of places that are just not doing it. And I think that they need the push and they need the appropriate voices at the right places strategically to make it work.
Thank you, Robert, and thank you all. And I'll add to that too as well, so that if you can't find one or it doesn't look like there is one at your institution, then maybe that's your nudge to be that leader. Which leads us into our first question from the audience, because it's kind of topical with what I just shared and what everyone has talked about. And it's something we've heard a lot, but maybe we can answer it specifically around the decarbonization efforts. But so how do we best address the increased fear that many health systems have about this political environment All right, I'm going to summarize because it keeps jumping around. How do we address when you go to your home institution and there is this fear in the political environment about aligning with initiatives around sustainability, decarbonization, things using the word greenhouse gas? So everything that you have shared so far, how do we navigate that new layer of it? Open to any of you to answer.
I can talk a little bit just because I stay in touch with a lot of people doing this work across the country, and sure enough, it's kind of true. What I'm hearing is some are being told, "Well, keep doing the work, but don't talk about it," or we're not going to be able to fund it as much this year, or we're closing the program, or keep going. So I think it varies a lot, and our experience is basically to keep going, but that goes back to this work being anchored in the mission for us. And I know we're different. Not every place is a Catholic health system in the West, the Pacific West, who's been very aware of this problem for a while. I'm grateful for that. And also, I guess I would just advise, whenever it's possible, you might have to do it a little bit more quietly for a while. But there's so much to be done. Don't stop if you can at all. There's still all of the diagnostic work of understanding, and then the treatment work of saying what's really going to be impactful in what we choose. So I hope that that's not happening to any of you. And I think that over time, the momentum is just going. I just came from a corporate conference about sustainability. It's incredible what the non-nonprofit world is doing, and that they've been doing for years because of requirements to report in the EU and elsewhere. They're way ahead of us. They're not stopping. Those rules aren't changing. They're getting a little bit less strict right now. But I say keep going again.
Yeah, I would say I would agree with everything that you said. You probably want to at least still be at the table to help modulate the message. You may not be able to push as hard, but I think that if a given entity is kind of considering pushing back or being, if they're pushing forward, that's great. Kind of encourage it. If they're kind of looking at kind of pulling back or being quiet in different ways, depending upon where you're coming from, your input and perspective can be very helpful to minimize the damage, quite frankly. So don't give up. You kind of want to still be there so that when things turn, hopefully, you will still be there in place to help make it happen right. But in the meantime, your perspective can help minimize what concerns there might be expressed publicly or be happening internally.
And I'll just give two specific examples of how folks are doing this on the ground. Maybe some of you too. Just there's so much creativity around how to continue to do this work, perhaps more quietly or in creative ways. One example is we work with a hospital. I won't say who it is, but they have I think it's an environmental sustainability committee, something like that is what they used to be called. And then they just changed the name to Energy Efficiency and Preparedness for Wildfires, is based on their geography committee. So really creative rebrand, continuing to meet, right? It's a little jargony, but like whatever it takes, right? This is an internal committee. That's what they decided to do. Or a similar example of a health system, their sustainability team was told, we can't do anything ESG. That's sort of a term that we have to stay away from. So they created a separate environmental committee, a separate social committee, and a separate governance committee. And they happen to meet at the exact same time and day every week. So it's completely separate, but they're doing it. So, I mean, whatever it takes, that creativity, I think, is going to be what allows this work to persist.
Thank you. So there's always another road. And so if the word sustainability doesn't work, really lean into the economic argument. I think that's worked for me a lot at both the institutions that I've been at, where I've been talking to leadership about sustainability initiatives. But if you're leading with the economic argument, and if you need to leave out sustainability or greenhouse gas emissions from the conversation, I think that's okay, right? It's a means to an end. But I think that we have enough data now in the literature to really show that really specific initiatives that reduce greenhouse gas emissions have a significant economic benefit. So find that data. If you need the data, there's so many resources, or you can email me and I will do a Google search for you. But lean into that economic argument. And the second thing is, it is a weird time. I had never been asked until this year to not use my academic affiliation on something that I wrote. And it happened. And these things happen. And, I think though that if you really believe in what you're doing, then you keep doing it. And, you're still getting the words out there. You're still having the conversation. I agree, with Robert that you don't want to make enemies, but you also want to continue the conversation to make it the social norm.
Just add real quick. So that's an interesting point. If you go to a state legislature and you're going to a public health committee or a meeting of some sort, doctors are told, "Oh, wear your white coat, wear your white coat." Well, if your white coat has your academic affiliation on it, sometimes there might be concern from that academic institution because they don't want you're not speaking on behalf of them, which you may not be. So just be aware that all these institutions, they have a long game. They have concerns when someone's out there wearing their label that it may be associated. So I was really put off when I was told, no, you have to put white tape over that because you might be on the TV camera. I've learned that's the game they play. And institutions, they're conservatively risk averse, and they have to be, I understand that, but don't be surprised if you speaking out personally on something gets a little bit of reservation from the organization that you might be with. It's not surprising at all.
Yeah, thank you all for that. We're coming up on time, but Emmie, I just want to jump on your points because it made me smile a little bit. And I haven't checked with Ed to see the efficacy of this yet, but I heard one of the potential tactics that we can all take is just to rename, like for our Action Collaborative, to rename it the Action Collaborative on red, white, and blue Freedom Eagles, and just to kind of do that across the board, then just keep doing the works. And if we just all did that at once, then it would be very hard to track. So maybe Emmie, I'll add on to that piece. So with that, we will thank you all for your attention and for our wonderful speakers. Another round of applause. In the spirit of now what, one of the reasons that NAM and one of the reasons that I was so excited to join this group and to come on is that we know that we all have a lot of convenings over the course of the spring, Clean Med as well. And we really wanted to work hard to make sure that not only were we not duplicating the work or duplicating the content of each of these meetings, but that we're actually building from one meeting to the other so that we can move forward together as a community. So with that, I invite you to join NAM at any point. As Emmie said, this is very much what you can do is come in and join our movement, and you will get an invitation to our Climate and Health Summit on April 22nd. Hope to see you all there. And then in addition to that, then that will lead us into Clean Med in May, and which you can see on the your right side of the screen. But come and talk to Emmie if you want more details on that. We're really working hard to make sure that we're building from one meeting to the other, but the only reason that, or the only way that you can hold us accountable is if you come to all of them. So hope to see you there, and thank you again.